When I arrived in New York, it was overwhelmingly joyful. Flying in, I see all the bright lights, like looking down at the city, and it felt like a movie. I'm originally from Texas. There's a lot of transphobia, homophobia. It wasn't a safe space for me to be in.
My life in Florida had just reached a standstill. It wasn't progressing. I thought if I don't transition and do it the way I need to for my safety, then I probably would not be alive right now.
Living in New York City without access to health services, it was difficult.
I'm just like how I'm gonna, keep track of like my health and stay on top of things.
I couldn't get my testosterone, and so my hormone levels had depleted exponentially, and I wasn't really sure what to do about it until I came to Callen-Lorde and I was able to get some help.
The mission of the Callen-Lorde HOTT Program is to provide sensitive, non-judgmental, affordable care that's appropriate for LGBTQ and homeless youth.
We want to try and reduce as many possible barriers that there are to accessing healthcare.
The HOTT program offers services to young people between the ages of 13 and 24, primary care, sexual health, which includes STI screenings and HIV testing, as well as HIV care and trans care.
We also offer behavioral health services, including therapy and support groups. We have access to dental care and an on-site pharmacy. We even have case managers that can help our youth navigate the system.
Well, every time a patient comes in and they do a full intake, the whole program is explained.
They stay open much later than I would expect.
But we also try to connect patients with anything outside of our agency that they might need.
If I needed somewhere to eat, they gave me information about places that do provide food as well as a place to sleep.
The great thing about Callen-Lorde and the HOTT program is that we will provide services to anybody regardless of their ability to pay.
We have a voucher program where for uninsured or underinsured patients, we assist in their obtaining medications.
One of our most successful features of the HOTT program has been our mobile medical unit.
So we do a lot here on the medical mobile unit. And it's very unique in the sense that it's like a clinic. We go to clubs, we go to other locations. It could be like street locations that that young people, where they may congregate.
It's the fastest way to get, whatever you want to check, get done.
Like that's where I go sometimes to get like my HIV and STI, STD checkup.
The HOTT program made a conscious decision to provide services to the House and Ball community because this was a community that needed access to health care.
It was important for us to start it because there was a lot of young people who wouldn't come to the clinic.
The majority of the young people involved tend to be young men of color, young trans women of color, and it coincides very much with our mission in the HOTT program to go to the places that need the most help.
And so when we're coming to them, we're not coming from a place of you need to do. No, we're coming from a place of this is what's offered, this is what you can do.
Another important service we offer here is access to PEP and PrEP. HIV prevention is so vital to the survival of our young people, and our goal is to educate them on the benefits of PEP and PrEP.
My doctor explained to me that PrEP is one a day pill that I take to protect myself against HIV.
On the other hand, there's PEP, which is HIV prevention after an exposure. In order to get PEP, you need to come in within 72 hours or 3 days and take the medications for the full month. Anyone can come to HOTT to access PEP.
PEP and PrEP might not be for everyone, but everyone in the HOTT program should know about it.
Every individual of the trans community should absolutely seek assistance at Callen-Lorde.
Callen-Lorde, including the HOTT program, is the leading healthcare provider in the country for trans care.
They was like really affirming and explaining like what would happen to my body.
They take the time to make sure their patients are safe and supported, and no matter what that looks like, that they get the care that they need.
I think we get young people because we don't judge.
They respect my gender identity, they respect my sexual identity.
Does not matter if you are straight, gay, bisexual, transgender, queer, intersex, gender nonconforming.
We help people do the things that they were meant to do. We help people survive.
The HOTT Program, Health Outreach to Teens. We get you.
To find out how to become a patient at HOTT, check us out at www.callen-lorde.org/HOTT or call us at 212-271-7212.